Welcome back, everybody. Moderna is asking the FDA to evaluate its COVID-19 vaccine for use in a booster shot. For more on that, let's welcome Dr. Kavita Patel, fellow at the Brookings Institution and former White House health policy director. Her latest op-ed for the Washington Post is titled, "The Confusion Surrounding Booster Shots Could Paralyze Vaccination Efforts. The Government Needs to Step Up." And Dr. Patel, I'm glad you said this because I'm confused. I don't know who's eligible, when you're allowed to do this. The government first said 8 months maybe, then 6 months. What's happening?
Yeah, Becky, you and me both, because we've got patients coming forward saying, well, we heard that Pfizer, said 6 months. And that's true. In fact, as you know, the supplement to their BLA for their booster dose is filed for a 6-month from the second dose. And then on top of that, we have this confusion about immunocompromised people who need quote unquote third doses. And that's also generated a great deal of confusion because, Becky, right now, you could pretty much walk into a pharmacy and because of this confusion, receive what you might think is a booster, what the pharmacist might be thinking is giving you a third dose. And in the end, nobody quite knows which one was the appropriate schedule.
What's the difference? Finally, data what is the difference between a third shot and a booster? I thought the booster was
no
the same.
Difference. That's exactly right. The shot itself is exactly the same shot as the first and second doses for Pfizer. Moderna, as you mentioned, is going to cut the dose and suggesting a half dose of their first and second doses. The difference is timing. The third dose for people who were immunocompromised really need 3 total doses to even just be considered fully vaccinated, compared to people who do not have one of those chronic conditions and should wait at least, it seems like, Becky, 6 months from the second dose. But again, that's very murky because now we've got this September 20th date that feels a bit arbitrary. And we don't quite know what will come on September 20th because the FDA has to take action and the CDC has to take action for recommendations. But it does feel like the entire country is kind of walking around trying to figure out when to get their boosters.
Yeah, I had one relative who got the third booster shot because of an immunocompromised situation. And then my next question was, should the people living with her also get a booster shot to make sure that they're not bringing something in? What's the answer to that?
Yeah, they don't. Studies really show that that particular individual who took the third dose to get that full vaccination series, you do not need to vaccinate the other household members if they do not have chronic conditions because their first J&J or first 2 doses of Pfizer and Moderna were sufficient to give them the antibody response. But for those again, it's a small population, Becky, 5% that have these conditions where they don't generate that much antibody response. But it does feel like a lot more people are kind of wandering around and wondering if they're immunocompromised, including people who are older.
That's what I was just going to say. What if you're older? What if you're somebody who's over the age of 70?
Yeah, Becky, this is exactly the data that's coming out of Israel and more emerging data, even from the United States. Cohort studies do point to the immunity decreasing, especially for people over the age of 60, and then also even more so over the age of 85. So it's why the CDC in their commentary this past week said, maybe we should be starting with boosters early for older people in long-term care facilities and healthcare workers. And that's not an unreasonable framework. But again, we're all talking about different frameworks, but I could go walk into a pharmacy today and probably just get a dose.
And would you recommend that? I mean, look, it seems like we've been talking about this for months, that maybe we should be doing this, thinking about doing some of these things. We still don't know the guidance, and I think people are kind of taking it on their own initiative. What should we be doing?
The peril, Becky, in getting something too early, let's say sooner than 6 to 8 months after your second dose. What if it's after 6 months?
Because a lot of people who are older have already passed 6 months. They're coming up on 8 months.
Yeah. The guidance is written for those kind of quote unquote immunocompromised individuals pretty broadly. So it's something obviously to talk about with your physician, but it's not unreasonable, especially if you are older, have a high risk of dying and being hospitalized. And with the data we have, it's certainly a conversation I've had with patients. But again, we're doing this without the FDA and CDC guidance. So I would say for most people, though, getting a shot too early, that booster shot too early, could disadvantage you 6 months after that. You want to have the spacing so that you have as much protection kind of over what we think is at least a 12-month period, maybe longer. So that's why. But I agree with you. I had a conversation with my parents where I wondered, should they be waiting until September 20th?